million people. Our study was initially not randomized, meaning we were selecting who we were going to test. And then after a few weeks of that, we had a lot of people coming in who were requesting the test for a variety of reasons. And we had employers who said, hey, I need my employees tested to come back to work. So we started really testing everyone who needed a test. And so our numbers really started to climb. Initially it was 6.5%, now it's 7%. And we realized that Kern County doesn't represent every county. Some people have been critical of that. I'm acutely aware of that. So I'm reporting my data and comparing it to, for instance, Stanford. Stanford just did they're doing antibody testing in Santa Clara County, and they're seeing between 2.5 and 4.16% positive rate, and which means that they have between 45 and 80,000 cases. Well, their health department reported 956. So this is 50 to 80 times the amount of positive cases in Santa Clara County. And in Kern County as well, the amount reported is fairly low, and we're saying we're getting about a 7% positive rate. So the numbers are likely much higher in those two counties than was anticipated by the numbers at Public Health.
I'm sure you've seen some of the data that these antibody testing, antigen testing, it has been, I would say, from a 60% to 90% accuracy rate, which is a broad view. But to your point, and the argument you're making is that counties are seeing different numbers. I know you're in Temecula, so I'm sure you're not unfamiliar with what's going on in San Diego versus what's going on in Kern County. But you still think the number of cases, positive cases, and the number of hospitalizations and deaths is more similar to something like the flu, and so your questioning is, why are we shutting everything down and making, on top of the health matters that are hurting, have it be so economically painful as well?
Well, and the conversation really has to be about herd immunity. So, each year, I've been following flu seasons for 15 years. Every year we have a season that ramps up in December, January, February. It starts tapering off in March. And we have a vaccine for flu. Well, how well is that working? We have in 2017, 2018, we had 60,000 deaths from flu, and we have a vaccine. So the conversation really needs to be about herd immunity and letting that run. So I think a good way to have this conversation is, who has done lockdown and who has not done lockdown, and has it mattered?
Right.
Yeah.
So when I look at the data globally, I look at Sweden and I look at California, New York, and the US, and I say, one locked down and one didn't. One let it run its course and one didn't. And has that affected the death rate? And the death rate has really been 150 per million for the United States and 200 per million for Sweden. Italy and Spain have 400 per million, and they locked down, which means their death rate was higher. And there's a variety of factors for that. I don't want to simplify, but what I'm saying is, sheltering in place and locking down was supposed to, the point of it was to not overwhelm our hospital systems. Well, in Kern County, our hospital census is very low. As I talk to the CEOs, their ICUs have very few patients. Their ERs don't have patients. They have many beds open, and we're saying, okay, for 2 months, we sheltered, we locked down, we did what was required. Now I think it's appropriate to start easing up and allowing the medical system to bring all of its people back and function at a normal level, because it doesn't make sense to send doctors and nurses home.
And I mean, obviously, trying to compare a New York City to a Sweden is, I mean, you can appreciate the critics that say that's a totally different situation. You're talking about a population with different comorbidities and the density being a little different. So you think maybe California should be treated like its own area, looking at the hospital capacity, looking at the death rates, infection rates, than in New York City, right?
Well, not even California. I would say specific counties. For instance, Kern County is spread out. We got 1 million people, and it's one of the biggest counties in California. LA is very population dense. And it's, similar to a New York style of living where people are in apartments and they're crammed together.
So do you think LA should stay locked down for a little longer? LA County, or do you think that it would be safe to reopen LA? I mean, I know you're not saying reopen everything, go back to life as normal. I know you're saying kind of get back into it, slowly reopen things. But do you think LA County should be treated differently than Kern County?
Yeah, and I think a prudent response is taking it county by county and looking at the population density and looking at the medical system in general and saying, is the medical system taxed? In Kern County, the answer is emphatically no. The hospitals are waiting for patients. The doctors are waiting for patients. Everybody's census is way down. I've even been told by some of the CEOs the hospitals cannot sustain with this level of patients.
Yeah,
they can't stay open.
Right, we've seen a number of facilities having to furlough nurses, doctors, etc. I wish we had so much more time because this is such an interesting discussion, but I did want to allow you before we go to respond, because I know in the news conference that you held with your partner, you had made comments about the health department director kind of agreeing with your stance on things, and then the health department spokesperson came out and said, no, that's not the case. Would you care to respond to that discrepancy?
Yeah, we had a discussion. He did not agree with me. We had a discussion about the best way to open up the city. We didn't come to any conclusions. I was basically asking Matt, I said, what's the best way to get the city back on its feet? How can I be helpful? And so right now we're getting the criteria for testing from Sonic. MD PhDs are looking at this in Kern County and saying, what's the best way to test? And we will likely do a 2 nasal swab test 24 hours apart, and we will test a certain part of the population. We're not going to test everyone. That's not prudent or feasible, but they're coming up with criteria, the PhDs in immunology that work for some of these big labs to get Americans back to work, and specifically to get Kern County back to work and then move out across California. And again, we need to work with the governor on this. Obviously, he's the one that's going to tell us when to go back to work. We're trying to be part of the solution and say, here's the data we found. Here's where Stanford is at. How do we get back to work?
Have you had any discussions with the governor? Because I know you've mentioned that a number of times, and hoping that he treats each county differently based on what their situation is, because economically it's been devastating to a lot of areas that aren't seeing those high numbers. Have you heard any response from lawmakers or governors, or are you making an effort to talk to the governor?
Yeah, Governor Newsom, I think, is doing a great job. He took a conservative point of view, and he's keeping people safe, and I think that's great. I'm meeting actually with 12 senators on Tuesday and their chiefs of staff to figure out what is the best way to move forward. And obviously, Gavin has a lot of people he's listening to, and I think he's doing a good job. And I just want to figure out, going forward, how can we work together to get California back on its feet?
All right, I certainly would like to see that. Dr. Erickson, thank you so much for your point of view this morning and for taking the time to talk with us.
So yeah, we're talking about the new reinforcement from the county here about street parades. What is the police, San Jose Police doing any differently? What's your first reaction to this?
Well, first reaction to this is incredibly frustrating. Since this began, it seems like the goalposts are not just moving for our community, but for law enforcement. Since day one, these orders have been ridiculously difficult to enforce. But now, I don't know how any police chief in this county could look at their community in the face and say, while people are being released out of jails on zero bail, serious criminals, that now we're going to stop people from holding signs, riding around and wishing individuals happy birthdays or happy graduations. I don't understand. I certainly can't look at my community credibly and tell them that. So yeah.
And those companies, the CNN and those other companies have been utterly compromised. They're not asking the questions of government officials that they need to be asking. And they're getting, they're bowing down and genuflecting to Anthony Fauci, who has a very well-documented and very checkered history of telling the truth, of not telling the truth, of abusing his power, and of resulting and of doing really sinister things like hiding the leukemia virus, and is known to be in 3 of our large vaccines that we know causes cancer. And he's hidden that from the American people. He fired the number one scientist at NIH when her studies showed that those vaccines were contaminated. And he also, Judy Mikovits, who worked for the agency, was on the team that identified the HIV vaccine, or HIV virus, and connected it to AIDS. And he kept that secret for 6 months so that he could get one of his cronies to make the publication. But that resulted in many, many people getting AIDS because the test was delayed by 6 months. Those things are, are really black spots on Tony Fauci's record. And to turn our entire nation over to Tony Fauci with this unquestioned reverence and the constant, genuine